Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Colorectal cancer, and we are looking at the risk factors. So the risk factors mainly includes there is dietary. So dietary, it includes the high animal fat diet. So high animal fat diet, and there is also the low fiber diet. There is low fiber diet. Next, there is also the presence of the alcohol. So there is also the presence of the alcohol. Then there is the hereditary syndromes. So hereditary syndromes includes FAP as well as the HNPCC. Other disorders include the inflammatory bowel disease IBD, the cholecystectomy. So this is increased right colon cancer. So this is nothing but increased right colon cancer, and this will be due to the exposure to the bile acids, so B acids. So let's recap this. So colorectal cancer risk factors: diet, high animal fiber diet, high animal fat diet, and low fiber diet, alcohol. In terms of the hereditary syndromes, there is FAP as well as HNPCC. This inflammatory bowel disease, there is cholecystectomy, which increases the right colon cancer, and this is due to the bile acids, exposure to the bile acids. Now, the other disorders are, which play as a risk factors, there is uterosigmoidostomy, uterosigmoidostomy. Then there is also smoking. There is acromegaly, and there is pelvic irradiation. So there is uterosigmoidostomy, smoking, acromegaly, as well as the pelvic irradiation. To learn and grow daily like this, please do subscribe.